Hi, my name's Robert Beaulieu. I'm one of the vascular surgeons here at the University of Michigan, and I'm going to present a case review for a case for which I used the ALTO to treat an infra-renal abdominal aortic aneurysm. The patient was a 73-year-old female, and she was ultimately diagnosed with a 6-centimeter infra-renal abdominal aortic aneurysm. She does have a history of COPD, for which she was being screened with a CT scan for lung cancer, given her known continued tobacco abuse. She also has a coronary artery disease history with an NSTEMI back in 2021, hypertension, hyperlipidemia, and mild CKD. On that mentioned lung screening CT scan, she was found to incidentally have a large infra-renal aortic aneurysm, which you can see demonstrated on the run-through here. Points of note are that it has quite an angulated neck that's a reverse taper just below the levels of the renal, and that there is a large sac with minimal thrombus burden. The iliac arteries themselves were not significantly small, but she did have small femoral arteries. She did undergo PFTs to see if she was a candidate for an open operation, but the DLCO ultimately demonstrated 56% of predicted. In planning for this case, I discussed with the patient that there are several features that made her treatment of her aneurysm with an EVAR graft somewhat high risk. These included a somewhat hostile neck with a small diameter of 17 millimeters, calcifications, and some lining atheroma, a large aneurysm sac size that was angulated as it came off, and then the reverse taper element of her neck. Ultimately, we elected to treat it with a 23 millimeter ALTO graft with the listed iliac limbs that you see there. These are some intraoperative images that show where we lined up our sealing ring. As you can see on the screen left, the mid-crown deployment was done with the top dot marking the mid-renal on the patient's right on the screen left. The portion that I'm outlining here is the mid portion of our sealing ring, right where we wanted it to land. As you can see, if you look all the way over to our screen right, once we deployed the integrated balloon, there's a reverse taper curve shape that you can see being taken by the balloon, which was what we noted on the preoperative CT scan as well. Again, you can see our pre-deployment angiogram, which was indicative of this very large aneurysm that had a reverse taper neck. Final angiogram demonstrated that there was a good proximal seal with no evidence of a type 1A or type 1B endoleak. We didn't see any type 3 endoleak as well. At our 30-day follow-up, we found that there was, again, good seal in the proximal portion, that it molded itself quite nicely to this area of calcification that you can see on the anterior and right portion of the juxtarenal aorta, and that within the aneurysm sac itself, there was a very small type 2 endoleak that we elected to continue watching, but that there was no evidence of a type 3, and that the aneurysm had been largely excluded. The patient was asymptomatic at the time of her follow-up and had been resuming her normal ADLs. Thank you very much.